CDC leaders are reporting more than 11,000 confirmed cases of monkeypox across the country. Experts believe the true number could be even higher. North Carolina state health leaders are reporting around 138 cases of the virus. Federal health officials say the country is concerned about the current supply of their vaccine. 1/5 of a usual vaccine dose is thought to be effective against monkeypox.
North Carolina's state epidemiologist, Dr. Zach Moore, is joining us this morning. And Dr. Moore, it's a pleasure to have you on the show. Thank you.
Yeah, thanks for having me, helping to get the word out.
Well, so let's talk about a couple of different things. We'll talk about COVID here in just a second because it is still around, whether we like it or not. But we do want to start with monkeypox. We've been talking about this now the last couple of months. We certainly don't want to scare anyone, but we want the information to be out there. How big of a problem is this here in North Carolina?
It's definitely a major concern, not just for us in North Carolina, but nationally. We've seen increases in cases. And I think for people who haven't maybe tuned in much to it, it's important to note it is an illness caused by a virus, but it's very different from COVID, which, as you said, is still with us and on everybody's minds. This one spreads mostly through close skin-to-skin contact with someone who's got the lesions, the skin lesions of monkeypox. It can spread in other ways, but it's not nearly as transmissible and not something that you're going to get from being in a room with somebody with monkeypox, for example, like you can with COVID.
Dr. Moore, we're talking about back to school. We know college students are moving in at some North Carolina universities. They already have plans in place for monkeypox, but is there a concern that these colleges start as hotspots for monkeypox? We know you can get it from maybe materials like bed sheets that students aren't the best at making sure those are clean. Is there any worry that these places could become hotspots for monkeypox?
Well, I think it's important for everybody to learn about how monkeypox spreads. We have seen some cases nationally occurring in college students. So I think it's not just for that population, but for everybody important to understand how it spreads and what you can do to protect yourself. But as I said, right now, monkeypox is mostly being spread through that direct skin-to-skin contact with people who have lesions, which is why it's so important. We're urging anybody who's got lesions that could look like sores or even pimples, particularly in the genital area, to get those checked out right away. Testing for monkeypox is widely available. If your doctor doesn't have access to that, you can contact your local health department, find out where that can be done, but that's widely available. And then we also have a vaccine, as you mentioned, so we're urging people who are in groups where we're seeing most of the monkeypox spread right now to go ahead and get vaccinated, and we're hoping to be able to broaden that soon so that everyone can protect themselves.
And Julian and I were looking at some numbers earlier this morning. Didn't find any numbers in the female population at all, which is interesting. And I think a lot of people that maybe aren't in the category of being an African-American male, if you're not in that category, then sometimes you go, well, this doesn't concern me at all. But we were surprised that we didn't see any numbers in women.
Yeah, you hit the nail on the head, and that's the concern we have is that, right now, most of the transmission, virtually all, is happening in networks of gay, bisexual, and other men who have sex with men. But at the same time, we know anyone can be infected with monkeypox, and we've seen cases elsewhere in the country starting to occur in other groups. So we really don't want people to think this is just somebody else's problem. We want everybody to get educated, everyone to know what they can do. But right now, virtually all of our cases are still in those networks of men who have sex with men. So that's where we're concentrating our efforts, particularly in terms of vaccination, to try to protect the people who are currently most at risk for getting exposed to the virus. But at the same time, we want everybody to be learning about this and everybody to be taking it seriously.
One more on the statistics that Jason just brought up there. He mentioned, people outside of the African-American male population. Looking at statistics, 78 right now in North Carolina, black or African men have that right now. 78, men to just 21 white males. Is there any reason that we're seeing that discrepancy? Is there anything the state has seen to kind of explain that?
Well, I think, unfortunately, this is the same group where we've seen increases in some other conditions. And, as I said, anyone can be impacted, but this virus is spread through social networks. So this happens to be the network right now where we're seeing most transmission in gay, bisexual, and other men who have sex with men, particularly, but not exclusively, black or African-American men who have sex with men. So that doesn't mean that this is only a problem for that group of people. Certainly it can affect anyone, but that's an important group for us to be focusing on right now, and making sure that people will have access to vaccines to protect themselves, have access to information about other ways they can stay safe.
Dr. Moore, I want to switch gears before we run out of time and talk a little bit about COVID. I know a lot of folks have COVID exhaustion and kind of think, oh, it's gone. It's in the rearview mirror. Don't need to talk about it anymore. Back to school. We're here starting, right? We had some start last week, some today, some in the next week or so. The governor is dropping the state of emergency today when it comes to COVID. What do we still need to know about it? What do we still need to be concerned with?
Well, I like your term. I count myself in the group that has COVID exhaustion, but it is still here, and we do still need to be alert and prepared. We have a pretty high level of COVID transmission right now, but we're in a very different place than we were last start of the school year. Virtually everyone in our entire state has some immunity, whether from vaccination or infection or both. So the rates of, fortunately, much more serious infections and deaths have gone down, but it still can be a very serious illness. So we still want people to be protecting themselves. We expect to have fall boosters coming out that will have additional protection against the Omicron and subvariants that are currently circulating. So really want people to get those vaccines, especially when those fall boosters become available, and take other steps to protect themselves, including the things we've been doing since the beginning. If you're going to be out in a crowded indoor space, masks are a great additional layer of protection.
Dr. Zach Moore, state epidemiologist with North Carolina Department of Health and Human Services. Thank you for your time today, and you and your team trying to keep us safe and educated as we start a new school year. We appreciate your time.
Thank you. Appreciate the time.